Here at Brookdale Health, and some of the funniest things happen over here, but we just kind of keep them to ourselves unless you come over here and visit. Right now, I'm sitting here with Dr. Fritz. How you doing, sir?
I'm doing fabulous. And you're right, we do have fun here. It's a family atmosphere, so we like to have fun occasionally.
Yes, sir. All right. Well, some things that are not as fun is when someone gets into an accident, and then we have to get them over here and find out what's going on with them. So what is something that you do when you first see your patient for the first time?
Well, first I tell them that, hey, you're in the right spot. This is a good starting point. We talk about, the experience they had. Getting in a car crash is very stressful. I mean, most of the time people are shaking after the crash. They're very, breathing heavy. They just don't know what to do. And they're in the car, banged up. How do I get my car fixed? The police are here. I got to deal with the police. I got to do this. All that, you have to go through the process. You got to call your insurance company. You got to make sure you're safe on the road. You're not in a vulnerable position on the road. Call the authorities. Get a report filed properly. If you need immediate medical attention, like ER, go get seen if you need to. But right after that, schedule an appointment and come on in to see us. We'll take you through the history, take you through the evaluation, talk about how your auto insurance can work for you to help pay some of the medical bills, and how lost wage components can work. If you have short-term disability, FMLA, there's a bunch of different things that go into it. So if you're unable to work, we walk you through that process too. But then we also evaluate you for your injuries. We get you started on a treatment plan and the road to recovery. Now, I call it a road because sometimes it's rocky, sometimes it's smooth. It all depends on how you're progressing, and that's why we utilize multiple modalities here.
And one thing that I love, especially working with you, because you are my chiropractor, what is it that you do to assure someone that you actually know what you're talking about?
Well, and the thing is, it's explaining things how they can understand it too. I'm not going to throw a bunch of scientific terms at you unless that's your background, then I'll use them. Sometimes I get patients that have the medical background, and I can use a lot of the more medical lingo and all that stuff, but it's making them feel comfortable and making them feel, okay, this is the process, what we're going to go through with treatment. If things aren't improving, I'm going to make sure I get you to the right people too. It's reassuring that, if it is an issue that we can't address, we're going to get you in the right place too. But a lot of the time, starting with that conservative, holistic approach where let's not jump to medication surgery, a lot of people like that approach. If we can start doing that first and you get better with that, awesome. We don't have to jump to that injections and all that stuff, but sometimes it's needed, and we'll get you to those people if you need to be too.
All right, and real quickly, can you talk to the people about the three-pronged approach?
Well, the three-pronged approach here at Brookdale Health is utilizing chiropractic care, physical therapy, and massage therapy. Chiropractic care is multifaceted. We utilize instruments, hands, different techniques to restore and promote healthy joints so the body functions better. If the spine isn't working right and the joints aren't working right, the body doesn't function right. So that's our goal with that. We also talk some nutrition and talk some home exercise too, but our physical therapy department is more the exercise component. They'll dive into home exercises. They'll have you do exercises here. If you do a surgery like a knee, they might do post-surgical rehab following an orthopedic, recommendations. And then our massage therapy department, they dive in and work those muscles out to get all that old blood, old inflammation pushed out so you can get some new nutrients to the tissues too. I always talk to patients, you get into an accident, you injure your body. The body's got to repair the tissues. It's like having a construction crew. You got to have materials available, so pay attention to your nutrition. That's key. Good protein, good vitamin C. There's a bunch of other things that come into play. But if you get an injury and you're not giving yourself the proper nutrition, it's like a construction crew just waiting on the lumber and materials to repair or build whatever they need to. They're just going to sit around until they have the materials available. So that's why we talk about those different things and why we utilize a three-pronged approach here to get people better faster.
That's why I always love speaking to you, because you break things down and you actually can see the picture in your brain when you're talking about it. So I definitely appreciate you breaking it down.
Hey, you're very welcome. It's always a pleasure to be on here, and shout out to Q-Bear. It's always good to see him and talk to him too.
All right. Well, we're going to go back to you, Mr. Walter Q-Bear Banks Jr. We are over here at Brookdale Health. We are the experts in auto injuries at 5740 Brooklyn Boulevard and Brooklyn Center on the corner of Bass Lake Road and Brooklyn Boulevard. You can